Okay, I think we're about ready to begin. I want to thank you all for joining us today. I hope you're all well and staying safe. I know my office has been inundated with questions about the vaccine and about the vaccine rollout, and I'm really happy that we were able to get Dr. Janna Kerins, the medical director of the Department of Public Health, to join us today, hopefully to get some of your questions answered. We are going to get going on this. Dr. Kerins, whenever you're ready, can take over.
Thank you so much, Alderman, and thank you everybody for joining and for submitting questions, and just echoing that I hope everybody is staying safe and healthy. So I am going to share a presentation. It does have some slides. I also did try to incorporate some of the questions I received in advance, and then obviously I'll try and address some of the questions that come in as well. So give me 1 second to get this going. Okay, hopefully everybody can see this now. So, so this is just, the first few slides are just an overview of the vaccine. I know that people mostly have questions about kind of registration and rollout, and so we'll get to that as well. All right, let's see. Okay, so just starting with some basics. People probably already know this, but there are two current vaccines that are available. So the Pfizer vaccine and the Moderna vaccine, and both of these are messenger RNA vaccines. The nice thing about both of these vaccines is neither of them can actually give you COVID-19. They vary from some of the kind of more common vaccines that we've gotten in the past, so that they don't actually contain the virus itself. And then both vaccines are safe and really effective against COVID. So these are just the two vaccines that I mentioned before. And I show this for a couple of reasons. One is to give people an idea of like how many people actually participated in some of the trials for these vaccines. And also to tell people that we're both found to be about 95% effective, which is great. Both vaccines do require the 2 doses. For Pfizer, that's 3 weeks apart, and then for Moderna, it's the 4 weeks apart. And I know there are a few questions about second doses specifically, so I'll get to some of those questions too. But it really is important that if people are getting vaccinated, that they do get both doses. So for Pfizer, which is where we have a little bit more information available, it was only found to be about 50% effective after the first dose versus that kind of 95% effective after the second dose. So these were some of the questions that I got specifically about the doses. So is there actually a difference between what is in the first dose of a vaccine and the second dose of a vaccine? And the answer to that is no. The vaccines are actually the same, similar to for example, a child who's receiving the measles, mumps, rubella, the MMR vaccine, where the contents are the same both times, but you need those multiple doses because it really primes the immune system to be able to respond to the virus in the future. And then, how long do you have to wait between the 2 doses? So that does vary a bit, like I just said before, depending on the type of vaccine. So the Pfizer vaccine, it's 3 weeks between the doses. Moderna, it's 4 weeks between the doses. And for the vaccines, there is a little bit of leeway too. So if, for example, you couldn't make it in at the 21-day mark for a Pfizer vaccine, then there is some room to actually kind of have the dose a little bit later. Typically, we want to get it between about a 6-week time frame. And then there were several questions asking about kind of how people will know that they'll definitely be able to get the second dose. And so the way that works is that is part of the planning process. So we do actually, so the vaccines come into the health department, and then we send them to the people who are actually doing the vaccinating. And so, so we specifically send those second doses as their own shipment, so that we can be sure that they're getting the same number of vaccines that they originally received. And then, is there a separate registration? That depends a little bit, depending on kind of where you get the vaccine. So for example, at the city pods, they do the registration for when to sign up to get, like to schedule an appointment to get that second vaccine, while actually on site. And I think a lot of the places do that as well. So vaccine side effects. So there are commonly side effects after receiving the vaccine. Typically the vaccine is given into the muscle in your arm, similar to, say, a flu vaccine. And so it's pretty common to see that your arm could be a little swollen or painful after the vaccine. Typically side effects happen a couple of days after the vaccine. And then other side effects that we commonly see is a fever, feeling tired, getting a headache, even chills or muscle pain or joint pain. And what that means is that the immune system is actually responding to the vaccine. The side effects are pretty commonly go away in just a few days, and they're typically mild. So there were also some questions about kind of who can get vaccinated and when. And so one of the questions that comes up is, are there any health conditions that prevent vaccination? So there are actually a very small number of things where we say you absolutely should not get vaccinated. And that is a history of having an allergic reaction to one of the parts of the vaccine. So there are places where you can look at all the different components of vaccine. Oftentimes there are very, very long names of things, but I think one of the common ones that we typically like to mention is called polyethylene glycol, or PEG. And so if people have had a severe allergic reaction to, for example, Miralax, which is polyethylene glycol, then we do not recommend that you get vaccinated. And same with another kind of long name thing called polysorbate. And then if somebody has a severe allergic reaction to the first dose of the vaccine, we would have you talk this over with a specialist, but they may not be able to get a second dose of the vaccine as well. In terms of kind of getting tested before vaccination, people do not need to be tested before vaccination. I saw before we started, somebody had asked about having had COVID in the past and then getting vaccinated. We do recommend that people are vaccinated even if they have had COVID-19, and the criteria is really that you have recovered from COVID-19. So you've gone through kind of that 10-day isolation time, and that your symptoms have improved. And similarly, if somebody has been exposed to COVID-19, then we do recommend you wait that 2-week period before you actually would get vaccinated as well. Okay, so just a little bit about what to expect. So I think we're all in this kind of before stage right now. But then when you're actually getting vaccinated, you should receive a fact sheet that gives you information about the vaccine itself. And then people are also getting a vaccine card that says that they have been vaccinated and gives the date and some information about the vaccine itself. I do recommend for those people that have things like smartphones, taking a picture of that card as well, so that you've got that record. And then after the vaccine, like I mentioned before, the vaccines that we have available right now do require the 2 doses. And we do tell people to expect that they can have some of the mild side effects that I mentioned before. V-Safe, which is on here, is an option, as something you can enroll in after a vaccine, and it tracks potential side effects. So it's a text-based application that you can sign up for. And then I'll get into this a little bit more later as well. But vaccination is just one measure. And so even though hopefully you will get vaccinated, it unfortunately does not mean that right away we can stop doing the things that we've been doing over the past year or so. So we still need to continue to cover your face with a mask. Still need to maintain social distancing, wash hands, those sorts of things, at least for the near future. Okay, a little bit more about vaccine distribution itself. So this is kind of my disclaimer that I might not be able to tell you exactly when you'll be able to get a vaccine. And I'll go into this a little bit more, but supplies are limited, and really we're just asking for people to be patient right now. I know that the process has been frustrating for a lot of people. And so just asking people to be patient. So these are the phases. You may have seen this already, but phase 1A, which started back in December, did just incorporate healthcare workers. Phase 1B, which is what we're in right now, starting, I believe, last week, incorporates both those who are age 65 and older, and those who are frontline essential workers. And I'll go into a little more details on these as well. And then phase 1C, which in Chicago we expect to start at the beginning of April, end of March, will include all the other essential workers, and then those with underlying medical conditions that are under age 65. And then phase 2, which is kind of everybody else, we expect to start around the beginning of June. So I know this is really busy, and there's a lot of information that's here, but this is just slightly more detail about some of those who are in each of the different phases. So phase B right now, as you can see, it's, Chicagoans who are age 65 and older, but we are asking healthcare providers to try and prioritize among their own populations, those who are kind of age 75 and older than those that are 65 to 74 with underlying conditions that put them at risk, and then kind of everybody over the age of 65. For the frontline essential workers, the industries are below, the industries are there, but include things like grocery store workers, educators, especially early childhood and K through 12 education, public transit, and then some workers like manufacturing, food processing facilities, agriculture as well. And post office workers are actually another one. So I show this, again, this gives slightly more detail as to who is within each of the different categories that were on the last slide. But then this also shows the approximate number of people that are within that category in Chicago. So just among those who are age 65 or older, it's over, we estimate it's over 350,000 people in the city itself. Education, which is another big group, is over 140,000 people. And I show you this, or I show you that last slide to give you an idea of how long it's really going to take to get through even those who are in phase 1B. So as of right now, the city is receiving about, it varies a little bit week to week, but about 35,000 doses of vaccine each week. And so at that pace, it's going to take about 20 weeks to get through all of those who are eligible to just have their first shot that are in phase 1B. So for those in phase 1B, given the numbers we have now, it'll take about 20 weeks to get through everyone. We are hoping that the number of vaccines that we get will go up. Unfortunately, we only find out about, well, this has changed a little bit, but we only find out how many doses we're going to get a couple of weeks in advance. So questions about vaccine supply. So when will people be able to get a vaccine easily? And I talked about this a little bit last week, in the last slide. So we only are getting currently enough vaccine for about 5% of those in phase 1B each week. And so the goal, like I mentioned before, is to try to get everybody a first dose for those who are eligible in phase 1B by the time we've gone through the end of March. Unfortunately, because there's so many changes in terms of vaccine supply and how many vaccines we receive, we don't have kind of a more specific timeline that we can provide. Another question was what pre-existing conditions are covered in phase 1C. And so these are just a few of the pre-existing conditions. There is a longer list, and it's currently being updated by both CDC maintains a list, IDPH, the state health department also maintains a list, and they're continually updating them. But some of the big ones that are included in that list include things like cancer, chronic kidney disease, and heart disease, respiratory diseases like COPD, obesity, type 2 diabetes. And like I said, there are others as well, but those are some of the more common conditions. And so that is relevant, especially to those who are between the ages of 16 and 64. So they would not necessarily qualify for a vaccine in phase 1C in that age unless they fulfill either kind of having those underlying conditions or if they fall into one of the employers that's considered essential. I got a specific question about the phase that educators are in, and so that depends a little bit on kind of the age, but early childhood education, so daycare, and then pre-K are phase 1B, as are kind of those in K through 12. And then phase 1C includes college and university educators. So how can I get a COVID-19 vaccine? This is the main question that people ask. And again, I'll try to address some of the specific questions that came in about this as well. So there are three primary ways right now for those that are eligible in phase 1B to get a vaccination. The first of those is through a healthcare provider, and then through a pharmacy, and then finally through an employer. Healthcare providers and pharmacies are, for the most part, focusing on those age 65 and above, where employer age is less of a consideration. I know that there are a number of people who have reached out to healthcare providers and have found that their doctor or doctor's office, wherever they get their health care, has not signed up to become a COVID-19 vaccinator. And so for those people, a pharmacy is the next option. Now, I also know that the pharmacies have gotten tons of phone calls and people trying to register for vaccine, and they simply don't have those enough slots to accommodate everybody that wants to be vaccinated. So I am aware of that. However, those are the two best options, especially for those that do not qualify in terms of employer. There were several questions also about vaccination locations. We do on our website have a list of vaccination locations. I will say that this is not a fully comprehensive list of all of those who are giving vaccination. In order to be included on this list, the location had to actually say that they wanted to be on the list, and so this is the ones that we have right now, but this may change. There also is a process that vaccinators have to go through in order to get the COVID-19 vaccine to give out to their patients. And so there are still providers that are going through that process and will be coming up as time goes on. Okay. So one of the most common questions that we get is asking about registering for a vaccine without internet access. And we are very aware that this is an issue. So obviously, kind of based on the last couple of slides, people can call their doctor, healthcare provider, or their pharmacy, and that's probably the first step. At the health department, we are working on setting up a hotline that people can call that can help with registration. We're also working on kind of another registration option for people as well. They're not up quite yet, but they will be hopefully soon. Where are vaccination sites in our neighborhood was another common question. So like I said, I was saying on the last slide, so there is that map that I just showed. Sorry, I didn't have it zoomed in to exactly this ward, but there are some locations around this area. And then, as I mentioned before, the map may not be fully comprehensive. And so reaching out to your provider is probably the first thing, in your pharmacy. And then knowing that we are adding people as well. So another question was whether people should register in multiple places to get the vaccine. The thing I think we're really concerned about with this is that if you do register in multiple places, we really just don't want you to take up more than one slot, because that means that somebody else won't be getting their vaccine. And so if you do register in more than one location, then making sure that you cancel that appointment so that others can also be vaccinated. And then there was a specific question about one of the tools that the health department has, which is called Shy COVID Coach. And so this is a website where you can sign up to receive text updates about the vaccine rollout. And it's available on our website. You can get there at chicago.gov/COVID-VAX, VAX. And so the Shy COVID Coach in and of itself is not a place to register for the vaccine. So I just wanted to make sure that people were clear on that. But it is a way for you to get updates, especially if you prefer to have someone text you rather than having to go onto the internet. So for those that have signed up for Shy COVID Coach, hopefully it's been helpful, but that does not mean that you're then registered in and of itself to get the vaccine. You would still have to register or talk to your provider or pharmacy. And then a question which I think is especially relevant for your location is for those people who have providers that are outside of Chicago. So if you live within Chicago but have a provider in Evanston, for example, then can you get the vaccine, in Evanston, or does it have to be in Chicago? And both Chicago and the surrounding counties have said that you can get the vaccine through your provider, even if your provider is in a different jurisdiction. So if you live or work in Chicago, or if your healthcare provider is here, then you can get your vaccine in Chicago, and the same is true of the other surrounding counties as well. So these set of questions, I think, were really good ones, and I wanted to just talk about a little bit. So I think essentially the sum of these questions is basically, when can life essentially return back to normal? So if you have been vaccinated, when can you go back and see your grandkids? Do you have to keep washing your hands, and can you have people into your homes? And I think there's probably no black and white answer to this. So typically for the vaccines, and you receive the 2 doses, like I said, typically 3 to 4 weeks apart. And then it takes another week or 2 until your immune system has kind of fully built up and is thought to be, at the point where the vaccine is quote unquote working. And so there's kind of that time frame. But after that, we still do recommend doing things like wearing a face covering and social distancing and washing your hands and being careful of what you can touch. The vaccines are quite effective, so they're thought to be about 95% effective. There is a small chance, though, that people can still become infected with COVID-19 despite the vaccine. And so we make this recommendation for a couple of different reasons. One is, it basically gives us time so that more people can be vaccinated and more people can be protected. And then also at this point, we're not 100% sure yet whether people who have been vaccinated can actually transmit the virus to someone else. And so it's not that the vaccine actually gives you COVID-19, but it is possible that you could have COVID-19 despite being vaccinated, and we don't know whether that would prevent you from spreading it to someone else. I think that for some of these questions, it's really a balance of kind of risks and benefits, and so there's a bit of a gray area, right? So in terms of having someone into your home, if you know that they're also, for example, being careful about COVID, even if they haven't been vaccinated, then that might be a safer situation to have someone over. In terms of visiting grandkids, I think that really depends on kind of, the risks that you see there. And I say that as somebody who has a young child who has not seen her grandparents in over a year. And so I understand kind of the difficulties there. And so I think that the vaccine is quite protective. And so just weighing kind of the benefit and the risks for each individual situation. Okay, I did get a specific question about vaccine scams, which I thought was a really good one. And so I wanted to also mention some specifics around the scams. So there has been, and you may have seen this on TV or heard it on the radio or something, that there have been scams identified where people will actually call you and try to offer you early access to a vaccine. And so I just wanted to provide some information here. So things that you should be wary about, especially if someone asks you to kind of pay out of pocket for a vaccine. In the city of Chicago, the vaccine should be free, so there should not be any cost to you. There may be a small fee that's charged to an insurance company, or if people are not insured, there is a federal program that covers that cost, but you should not be expected to pay upfront. So in terms of a vaccine waiting list or early access, if somebody calls you and offers that and you're not familiar with them, so you don't have any affiliation with them, if it's something, we've heard about calls from people saying that they're the World Health Organization or the CDC, those are not the people that would be calling you to offer you vaccines, so be wary of that. Anything that's offering to sell COVID-19 vaccines, that's not how the process works right now. And again, anything that's offering vaccine in return for payment. And then also just kind of general protection measures. Don't give out your social security number. Don't pay to buy a vaccine or pay for a gift card to get a vaccine. That's not how the process is working right now. And then, like I said before, the vaccine should be offered to you without cost. Okay, and then I think this is probably the last slide that I have, but just a few additional questions to cover as well. So if you choose not to get the vaccine, so say you're eligible in phase 1B and you choose not to get the vaccination now, can you get it later? And the answer to that is yes. Right now there's currently a number of people who would like to have the vaccine. If you opt to wait, then you can get it at a later time. And then another question was, will future vaccines protect against other strains? And so I'm sure people have heard in the news about some of the other strains, for example, from the UK or from South Africa. And I think, unfortunately, it's just a little bit too early to know about that right now. I know there are several vaccine companies that are exploring different options, whether that's giving an extra dose of vaccine or if it's tweaking the formula for the vaccine to try and make sure that these other strains will be protected. What I would say right now is that the vaccines do still seem to be effective. And so if you are given the opportunity to get a vaccine now, then I would take it. Somebody asked about volunteering to help give vaccinations. So first of all, thank you. I think we're always happy to have help. So there is an email here that you can reach out to. There is also for medical professionals, those that have retired, for example, an organization called Illinois Helps, if you're not already familiar with it, where you can also sign up to volunteer. That's been going on throughout the pandemic. I do not know, part of the question was about kind of location, and I don't know how they determine kind of where you get to work and whether you have any choice in that, unfortunately. Oh, and then I had the vaccine scams question on here as well, although I think we already addressed that. And then I think that's it for the slides that I have. So let me stop sharing here. Okay. And then let me start going through some of the questions that we've received. Okay. All right. Okay, so one of the questions is, will those who are administering the vaccine conduct a health screening at the day of the appointment? And so, yes, most places are conducting a health screening where they ask you about questions about your health and your health history. For those that have underlying health conditions where they are concerned about getting the vaccine, then I do recommend that you talk to your healthcare provider, and that is also likely the safest place for you to get the vaccine as well, because they know those underlying conditions and they can monitor you afterwards. Okay, and then, oops, sorry, my screen is jumping around. Another question is, we hear about many vaccines being tossed due to missed appointments, and is there a plan to prevent that or to make sure that vaccines are being given instead of being thrown out? So vaccines are not being thrown out in the city of Chicago. We do not throw out vaccines. We call people until we find people to give vaccines to, if there is any concern about that, but there are not vaccines being thrown out. So I just want to make sure that we clarify that. Vaccines are very hot commodity right now, and we would not throw them out. The next question is, any opinion regarding receiving monoclonal antibodies? And so I'm not sure whether that is referring to kind of treatment or what, but I probably would have to get back to you on that anyway, because that is not my area of expertise. And so so if we need to follow up, I'm happy to do that. Okay. And then the next question is, the next question is, when you say the city is getting 35 doses or 5% of need per week, do you mean only CDPH vaccination sites, or do you mean the total number of vaccines coming into the city of Chicago through various distribution sites, including hospitals and pharmacies? So that is all that the entire city is getting. So basically the city kind of acts as a distributor of vaccines. So those vaccines come into the city and then we distribute them to hospitals, pharmacies, healthcare providers. And that total number is 35,000. I wish that we were receiving 35,000 just for the CDPH vaccination sites alone, but that's not true. Can we get a copy of the slides? I believe that you can get a copy of the slides, and I can follow up with the alderman to address that. The next question is, where do social service agencies that are seeing senior clients on a daily basis fall? Would the staff be considered essential workers? That depends a little bit on the role as to whether they would be phase 1B or phase 1C. And so if you have additional details, I can always follow up with you on that. But there are, for example, places like congregate living settings, whether that is senior living or facilities with, that have clients with developmental or behavioral health disabilities. Those are considered phase 1B. Any predictions on when clinical trials will be complete on children under 16? I wish I knew the answer to that, but unfortunately I don't. I think what we have heard is that it will probably be a gradual process. So for those that don't know, the Pfizer vaccine is approved for anyone age 16 and above, and the Moderna vaccine is approved for those ages 18 and above. And right now there are not any vaccines that are approved for anyone under the age of 16. And so what we have heard is that this will probably be a gradual process where the vaccine will be approved for essentially kind of slowly downtrending in the numbers. So like first it will probably be for those that are 14 and 15, for example, and then those children that are 12 and 13. But I unfortunately do not know when that will happen, and that occurs at the federal level as well. So that's unfortunately out of our control. And then the next question is, if we register with our healthcare provider or pharmacy, do we also need to register with the Chicago Health Department or with Cook County? And the answer to that is no. If you have already registered with your healthcare provider or your pharmacy, then you do not need to do any further registration. And hopefully that will work out, but the city does not need a separate registration. The healthcare and the pharmacy will do the whole process for you. The next question is, if someone misses their vaccine appointment, can it be used for someone else before it spoils? And yes, so that is something that we absolutely do. So this is a place where we call people until we are able to find someone to give an appointment to. I know that healthcare providers are doing the same thing. I've heard stories about people who've been told they have a half hour to get to their doctor's office to get a vaccine. I don't know how commonly that occurs, but I know that people are trying to make sure that the vaccine doesn't spoil. And then also there is, kind of some leeway time. It's not that, so the vaccines are typically frozen. And so once they're defrosted, there is a little bit of time where they can stay in the refrigerator. So it's not that they spoil for, that day, for example. I believe for the Pfizer vaccine, it's something like they can stay in the refrigerator for about a week. So the vaccine does not go bad right away. With news about the Johnson & Johnson vaccine and the Novavax vaccine looking promising, if those vaccines get emergency authorization from the CDC, how do I anticipate that these would impact vaccine distribution and timelines in Chicago? So I think we're very hopeful that both the Johnson & Johnson and Novavax vaccine will be approved. I think specifically with Johnson & Johnson, we've heard that it could be, kind of mid to end of February or even early March. And I think that with the approval of these, then it just speeds up the timeline. It allows us to have more vaccine that's available to us. And so, although we don't know yet, like how exactly it will affect the numbers that we're receiving, I think if the vaccine is effective and is approved, then having more vaccine available to our residents is a good thing. The next question is, when you announce that you will be receiving 40,000 doses in a week, does that mean that will be enough for 40,000 people or just 20,000? Oh yeah, thank you. Thank you for asking that, for allowing me to clarify. So typically it's about 35,000 first doses of vaccine, and then the second doses are part of a separate shipment. Sorry if I wasn't clear about that. Okay, the next question is, after the second vaccination, how long can negative reactions typically last? Can they be close to incapacitating? So the negative reactions, so side effects, like I said before, are typically mild. So they're typically things like a headache. Honestly, they're flu-like symptoms. So especially during the winter, kind of like a bad cold type symptoms. So things like headache, fever, chills. And they typically only last for a few days. That being said, they can feel like you have the flu. And so, it can be a bit uncomfortable, but they are usually mild symptoms and they usually only last for a few days. The next question is, I heard that many non-residents are getting vaccinated in Chicago. Is there any way to get additional vaccine in Chicago to accommodate vaccinating the wider region? So you're right. People that live or work in Chicago or that have a healthcare provider in Chicago can get vaccinated in Chicago. But the same is also true for the surrounding counties. So for those that live in Chicago but work or have a healthcare provider outside of Chicago, they can get vaccinated kind of outside of Chicago as well. Those numbers don't, at least the way they are now, they don't quite even out, but they do help it to get closer. I can't tell you whether that's being taken into account or not in terms of how the vaccine doses are being distributed. That is unfortunately above my pay grade, but I do want to just make clear that this is not, just that everybody's coming to Chicago and getting vaccinated, but there is some kind of even distribution of this throughout the state. Okay, the next question is, I work in after-school programming in person and run a school pods program with 8 to 15-year-olds. We don't have ID cards, so what kind of proof do I need to bring in order to prove that our staff is in the phase 1B category? So in Chicago, we do not require an ID in order to get vaccinated. The city pods especially do not require you to have an ID, although you do have to fill out some personal health information. So things like your name and your date of birth, for example. We also don't ask about things like immigration status, that sort of thing, in order to get vaccinated. And that is just to have as much equity as we can. For a healthcare provider or a pharmacy, there may be a slight difference in kind of what you need to provide, but typically people do not need to actually provide an ID. So for somebody that is actually an employer and is part of the part of the phase 1B as an employer, then there is a way for them to sign up their employees to get vaccinated. And that is on our website. There's a short survey that an employer would fill out about the number of employees that they have. And then that would get sent to the city. And the city would then follow back up to essentially allow you to register for vaccination at the city pods or the city points of dispensing. And so you would need to just fill out that survey with some information about your program. And then especially if it's kind of outside of CPS, and then that will allow you to get registered. The thing I will say about that too is that it's not an immediate process, so just bear with us in terms of patients too. We're still at the city pods vaccinating some healthcare workers, so it may take a little bit of time also. Okay. The next question is, why are some systems getting vaccines such as Rush and UFC and not others such as North Shore and Amida? So I'm not sure that I can 100% answer that. Rush and UFC are getting vaccines, but every hospital within Chicago is getting vaccine from the city of Chicago. With North Shore and Amida, I know they have multiple locations, and locations are outside of the city. So it could be that you know, something with their health department, but I don't. Every hospital should be receiving vaccines, so there shouldn't be any that are not receiving vaccine, even if the numbers might be variable from week to week. Excuse me. Okay. So somebody asked, can you repeat if a vaccine is free if I'm a city of Chicago resident, but get the vaccine at my doctor in Evanston? So the vaccine should be free. There should be no cost for the vaccine. However, there may be a fee that is charged to your insurance company. And that's kind of regardless of where you live. And then if you don't have insurance, then like I said, that fee should be covered by HRSA, which is a federal program. The next question is, I have 4 different numbers for registering for the vaccine. So what can I do to correct this? And so if that means, if you're asking that you've been registered 4 times and you're trying to correct it, then I would say that's amazing. I think there are others here that would love to have those other 3 spots, but I would contact whoever you are registered with and follow up with them directly about getting that corrected, so that other spots aren't taken up. The next question is, do you recommend double masking? And I think that, so I'm sure people have heard Dr. Fauci talk about this. Some people from the CDC talk about this as well. CDC guidance hasn't specifically come out about this, although I have heard that there's going to be a paper released about it this week that might, while it doesn't talk about double masking specifically, will give more information about kind of the effectiveness of different types of materials for masking. So I would say that kind of my opinion on double masking is that the jury is still out. I don't think it would do any harm. I do think it's important to make sure that you're still taking care to not touch your face and adjust your mask, making sure that you're washing your hands. And then when you're taking your mask on and off, making sure you're doing it kind of from the sides and not touching right around your face and mouth. The next question is, can I add a pre-existing condition to my registry? It turns out that I may have one after all. And so this depends a little bit about what you're talking about in terms of your registration. So if you have registered to vaccinate with them, with someone specific, you'll probably need to follow up with them specifically. And then, and if it's your healthcare provider or your pharmacy, then they should be aware of pre-existing conditions that you may have already. The next question is about a specific location getting vaccine. And so, so this is specifically about Park Plaza. So I'm not familiar with that facility in particular. There is a way for those who would like to become a facility that does vaccinate. There is information on our website about how they can go through the process to enroll. And if they have specific questions, then we do have information that we can send to them as well. So if there's someone from that facility that wants to make sure that their facility becomes a site that provides vaccine, then I'd be happy to follow up with them on those requirements and how they make it through that process. The next question is polyethylene glycol different from polypropyl glycol used in vaping devices? And so I believe they are different. To be honest, I'm not 100% sure. I can always check on the two devices. I'm not very familiar with the products that are in vaping devices. However, the contraindication to vaccination is an allergic reaction. And so that is something like anaphylaxis, hives. So if you've had a true reaction where you had to be treated by a doctor, then that would be a reason to not get vaccinated. If you have concerns about that, you can always talk with your physician as well. The next question is, can Chicago residents get vaccinated at suburban Cook County sites? And so this is kind of similar to what I said before. If people have, healthcare providers that are outside of Chicago, if they work outside of Chicago, then they can get vaccinated outside of Chicago as well. Similar to people being able to get vaccinated inside Chicago. The next question is, when is the best time of day to look for open appointments? And I don't know the answer to that. I think that's very specific to who you're trying to get an appointment with. So if it's with your pharmacy or with your healthcare provider, then they are probably the best contacts for that. The next question is, can two people be scheduled to be vaccinated on the same day? There are many thousands of people that are being vaccinated each day. So I'm not sure, maybe I'm misunderstanding the question. Scheduled to be vaccinated on the same day. So yeah, I'm not sure that I'm fully understanding the question, but there are, if you are scheduled in multiple locations, then we recommend that you only be scheduled in one location to get vaccinated, so you don't take up 2 appointments. But there are numerous people who are getting the vaccine each day. The next question is, are there any walk-in, no appointment needed sites? At this point, all of the sites that are within Chicago are still appointment-based. The next question is, you mentioned that those who are obese can get the vaccine early with those with an underlying health condition. Can I get the vaccine early? For those who fall into the 16 to 64-year-old category that have an underlying condition, including one of the ones that I've mentioned, then they can fall into phase 1C. At this point, those the underlying health conditions are still being updated, and so we should have more information on those. But currently, right now, obesity does count as an underlying health condition. The next question is, why aren't CPS schools being used to administer vaccines? And I can't answer that. I have not been part of the conversations with CPS about vaccines, and so I don't know the answer to that one. The next question is, how can I find a more specific list of health conditions for Group 1C? There is a list on the CDC website. I checked the website, and this is asking about a specific health condition. There is a list on the CDC website. It looks like you've looked at it already, because there's basically just a category that says other conditions. And I think one of the issues with the lists that both CDC and then the state are aware of is that that list is based on kind of having data to show that if you have that condition, that you're at an increased risk for COVID-19. And there are many conditions where we don't necessarily have data, either because the conditions are rare or because we haven't asked about them in a formal way. And so, so right now, like I said, that list of other conditions is being added to, and that's a work in progress. And so I would keep checking that. That will be both on the state site and then also on CDC's website. I know both are supposed to be updated. Unfortunately, I don't have a time frame for that though. And then you can always check with your healthcare provider as well. The next one is just a comment about a healthcare facility who's not performing vaccination. And like I said, you know, if there are healthcare providers that are interested in becoming vaccinators, then they can reach out to us and we can help facilitate them getting going through that process. Somebody's asking about among those who are 65 years and old or over, how the selection process is organized, so how we prioritize within that group. And so the way that we prioritize that is based on some of the science that we have available. So the highest priority is those ages 75 and older, and then those that are aged 65 to 74 that have underlying health conditions, and then finally those that are 65 to 74 without underlying health conditions. And that is how we have asked people to prioritize, but I think, you know, specifically with healthcare providers, they're doing that prioritization on their own. Someone asked, if I get the vaccine at one site, do I need to return to the same site for a second shot? And that's a good question. I know that has come up before. And so you do not necessarily need to return to the same site to get your second vaccine. However, it does make it easier if you do go to the same site. They have record of your previous vaccination, so they know the type of vaccine you got. They know for sure the date, but you do not have to go to the same site as the first time. The next question is, would you say it's correct that the vaccination doesn't prevent you from catching COVID-19 as much as it prevents you from getting sick? Therefore, you may still be contagious even if you're not ill. So what I'll say about that is that the intent of the vaccinations was to prevent serious COVID-19 illness. And so that even if you have been vaccinated, you can, unfortunately, rarely still get COVID-19, and because people can be asymptomatic, so not having any symptoms with COVID-19, then you still can be contagious if you're not showing any symptoms. I hope I answered that question. The next question is, do you know how long vaccine protection lasts? Will we have to be vaccinated again in the fall? So I don't think we know right now how long the vaccine protection lasts. That being said, we don't anticipate that people will have to be vaccinated again in the fall. Next question is, who determines how many doses the city of Chicago receives? I'm not sure whether that's done on the state or the federal level, but it is one of those two. The next question is, if you had a negative reaction to the shingles vaccine, or really any other vaccine for that matter, would you potentially have a bad reaction to the COVID-19 vaccine? And the answer to that is not necessarily, because the vaccines are different. So the vaccines are both kind of different in how they work, one being an mRNA vaccine, while shingles is not. And then also the components of them may be different as well. So if there are the same components in a shingles vaccine as there are in the COVID-19 vaccine, then that could be a reason to not get vaccinated. But in and of itself, having had a reaction to the shingles vaccine doesn't mean you can't get the COVID-19 vaccine. And then I'm sorry, but it's after 1 and I am going to have to jump off the call because I have to have another meeting about vaccines. So let me turn it over to Alderman Silverstein again.
Thank you very much, Doctor, for spending this time with you. Can I just ask you one quick question of my own?
Yeah.
I am hearing that, given that this vaccine could cause some, side effects, some people might want to take a Tylenol before they get their shot. And I'm hearing that that may not be a good idea. Can you just talk about that for a second?
Yeah, you're right. So we don't recommend that people take any medication in advance of the vaccine. The CDC has come out with some guidance around that. I don't remember the reasoning behind it. I'm sorry, I can follow up with you, but they did recommend to not take something beforehand, but you can take something afterwards if needed. So
as soon if you do feel some kind of a side effect, you can then take a Tylenol.
Yeah, exactly.
Okay. Well, again, I want to thank you so much for spending so much of your time with us. And I know you went through a lot of questions. There are still more. So if it's okay with you, we'll continue to direct those questions to you and try to get back to the residents here as quickly as possible with those that you weren't able to answer. I know this was very helpful, so thank you very, very much. And again, to everybody out there, thank you for participating. For those of you who know people that want to hear this, it will be posted on our Facebook, so you can listen to it again. The slides will be on there again for those of you who want to take another look at them. And just continue to be safe, everybody. We got to get through this. So just continue wearing your masks, social distance, and everybody, please just stay well. Thank you so, so much. Have a great afternoon.